right, this is a test. I am testing to see if I'm live. I have a live meeting at 6. So this is only a test. Okay, let's see if I'm actually live. All right, this is live on custom live stream.
Hello, how are you?
Hello, who is there, Abel?
No, this is Oren.
Okay, I'm just testing. Hold on.
Oh, I think I'm a little too
Stay there, stay there. I'm doing a custom live stream, therefore I'll be live on many platforms. So that's what I'm trying to look at right now. Okay, so I'm going to check Facebook to see if we're there.
Sure.
Let me go ahead and check. You know, when you're new to these things, it happens.
Yes.
So,
Yeah.
all right, so we are actually on. All right, great. So we'll just go on a little early because I'm not going to log off. So I see that we're on Facebook. I'm not sure if we are on YouTube. What we did, I connected the Zoom to various pages. So
Okay.
we could be live streaming in multiple platforms at the same time. You know, with
Right.
this COVID-19, we have learned a lot because we had to stay home.
Right. Definitely.
So we have learned a lot. So we want to put this in practice right now. And we're just going to go ahead and start a little bit. It's a very informal meeting.
Okay.
You know, the month of November is Diabetes Awareness Month. Last month it was breast cancer, and this month is diabetes. Now we know that worldwide we have over 550 million people with diabetes. And in the United States alone, we have about 120 million. 34 of those millions are actually diagnosed, and about, say, 88 million are pre-diabetics.
Right.
So we just have a lot of diabetes. Actually, diabetes is an epidemic right now worldwide. And we wonder, why is it that so many people are being diagnosed with diabetes? And that's something we have to go in. I'm an internal medicine doctor, and I see young people coming in with diabetes. All right, so I want to welcome all our friends that are joining us on Zoom or on Facebook or YouTube. Today we're going to be discussing diabetes and nutrition, because we do know that type 2 diabetes, it is believed that 80 to 90% of patients with type 2 diabetes can actually reverse, improve, or prevent their the disease using nutrition and lifestyle. So my name is Dr. Cooper-Dockery, and I'm board certified in internal medicine. And I have been practicing medicine for many, many years. Left medical school in 91. And since 96, I've been in South Texas. And today I have Mr. All right now, Crawford. First name.
Crawford.
Okay, Mr. Crawford. All right. So, all right, Oren. See, I see your name there now.
Yes, already.
He has a master's degree in nutrition and wellness. He has been practicing for over 14 years. He has done acute dietary practice in a hospital setting. And for the last 8 years or so, he has been working with patients with chronic kidney disease. Actually, I think you're currently employed in a dialysis facility.
Right.
Patients now that it's a bit too late to reverse their disease process.
Absolutely.
You know, in our early chat, you told me that
we leave about 4:30, I think.
you'd have loved to have seen these patients.
Oh, I need to reach there.
Jonette,
Yes.
mute yourself for now, and then when you're going to speak, you're on mute. You told me that you'd love to have seen these patients prior to the chronic kidney disease, because we know that diabetes is a common cause for chronic kidney disease, for many diseases such as heart disease, cardiovascular, stroke,
Yeah,
amputation of lower extremities, and renal failure.
absolutely.
So it would have been better to have gotten those patients in prior to getting on dialysis so that you could have taught them how to use healthy lifestyle and nutrition to prevent getting to kidney failure. So I
Yes.
want to welcome Mr. Crawford, and he's going to give us a presentation on diabetes. And then if you have questions, you can put them there for us to answer at the end of the presentation. So let me welcome Oren Crawford as you talk to us about diabetes and nutrition.
Well, thank you, Dr. Cooper, for giving me the opportunity to be on your platform today. I appreciate that. So, like Dr. Cooper earlier said, I'm a registered dietitian. I've been practicing dietetics for about 14 years now. When you're having fun, the time flies by.
Mm-hmm.
Like you said, I started out in the hospital setting, in center, just seeing different patients, cardiac patients, med surge, um, dialysis patients, as well as diabetic patients. And so I did that for 5 years, and then after that, I transitioned to doing renal dietetics with a dialysis facility. Been doing that for 8 years, and as you said, one of the main causes of kidney problem is diabetes, along with hypertension. And so we see a lot of patients who come to us with end-stage renal disease secondary to because of diabetes and hypertension. And like you said, when it gets to end-stage renal disease, which is stage 5, chronic kidney disease, it is kind of late. It
Mm-hmm.
is, it is kind of late um, to get things, going in the opposite direction. So the best thing to do is to start from the beginning, where no, you're having kidney function greater than 90, 60 to 90, and you're taking precaution in terms of using diet, exercise, and other natural principles to prevent the onset of diabetes. In this presentation, just wanted to share some principles on and uh, nutrition and the disease process, so that we don't get to that situation where we are, ending up with, onslaught of diabetes and going into renal failure and so forth. So I'm going to share my screen. Do I have that privilege?
Screen, let's see, how do I do that?
Let me
I
see.
think
Okay.
you
Oh,
probably do.
okay. Yeah, I do. I do
There
have
you go.
privilege.
Mm-hmm.
Okay. All right. That wasn't too bad. Okay. Okay. So we have. Do you think we started a little early? Because I kind of wanted to have some more interaction
Okay.
in terms of the participants. Should we kind of
Yeah, we can wait. Mm-hmm.
wait a little bit more?
All right. So we're going to ask all of you that are on right now, you can share. We got on early, so I was testing the platform actually, and I
Right.
didn't want to get off to start again, but we can actually wait for more people to sign on. And for those of you who are on, can you go ahead and share so we can get some other people to sign on? Okay, so go ahead and share, and I will see if I can get it on YouTube as well. I'm not sure how to do that. Let me send a message. But
Okay.
yes, we can wait a little bit before you go into the formal discussion. So where are you currently employed?
Yeah, sure. So I've been with DaVita dialysis for the last 8 years.
Mm-hmm.
where we see, dialysis patients.
Mm-hmm.
As it relates to diet intervention, there are a couple of things that we do when it comes to kidney disease. Um, you know, education is important. We also, work with on the medication side of things too, with different binders and you know, Hectorol and calcitriol, vitamin D analogs.
Mm-hmm.
But as it relates to the nutrition side, um, we're more about limiting those things that are going to cause further injury to to the kidney,
Mm-hmm.
or right. So like potassium, limiting potassium intake, limiting phosphorus intake, and limiting sodium and fluid, optimizing protein for best outcome. So when they're in renal failure, the best that we can do is really to kind of slow the progression of renal disease.
Mm-hmm. Mm-hmm.
Um, so we have those diet intervention.
Right, right.
But
How do you counsel your patients that already have chronic kidney disease? Because a couple of weeks ago, a young man called me. He is diabetic, and then he had chronic kidney disease. I think it was stage 3 or 4, not on dialysis yet. He changed to a plant-based whole food diet, and he reversed his disease to one of the earlier stages. Okay. Now, how do you counsel your patient before you go into your formal presentation?
right.
How do you counsel your patients do you see patients before they get to dialysis, or do you only see the ones that are already on dialysis?
Yes, I usually just see the ones who are in stage 5.
Okay. So you see
So
stage five.
they're starting on dialysis. But you do make a good point there in
Mhm.
terms of patients who haven't gotten on dialysis yet. Yeah, one of the things that we do emphasize is reducing protein, specifically animal protein,
Right.
because animal protein is known to be more dangerous to the kidney. uh,
Mm-hmm.
the byproduct of animal protein metabolism. You have a lot more BUN, blood urine nitrogen, coming off, and so it's a little more difficult for the kidney to handle the breakdown of animal protein. So we recommend plant-based and lowering protein intake, in
Mm-hmm.
general, because plant-based protein, it's not as difficult for the kidney to metabolize, the
Right.
byproduct.
Right.
So definitely plant-based is the way to go to really prevent the progression of chronic kidney disease.
I
Um,
agree.
you know,
The animal protein comes also with a lot of saturated fat,
right,
and that is can cause inflammation of the endothelial lining of the blood vessel and
right,
create more problems, flow of blood to the kidneys and to other organs as well. So sometimes people believe that, oh, I need to have a lot of protein. I had a patient who came to me and she had chronic kidney disease, and I was counseling the patient on plant-based nutrition, and she asked me, where do I get my protein from? Not knowing that we have a high protein content in just about all plant-based foods,
right,
beans and nuts and seeds, broccoli, tofu, all that, you
right.
know
Yeah, we definitely don't have a lack of protein when it comes to plant-based. I've actually been practicing plant-based nutrition for about 20 years, on and off, but
Mhm.
more stable over the past, like, say, 10 years.
Good.
And one of the questions that I get a lot is, what do you eat for protein?
Mm-hmm.
For
Mm-hmm.
protein, and I'm like, I eat plant-based protein, nuts, beans, seeds, even some of the carbohydrate items have a small amount of protein. So you get plenty of protein, and you know, when protein is broken down, whether it's animal protein or protein, they're broken down to amino acids, which are
Hmm.
pretty much the same thing, and so the body utilizes it in the same way.
Right.
Yeah, and you know, recently I did some lab work, and you know, I was looking at my albumin level, and it was 4.5, and anything
Hmm.
over 4 is good.
Exactly.
So and you know, like I said, I've been doing plant-based protein for the last 10 years. So you know, we get our protein. And you know,
Exactly.
that's one of the things that we look at too with end-stage renal disease patients is their albumin levels. And you know, even though they eat, you know, like animal protein, you know, some of them do get their protein above 4.0, but many of them don't.
Hmm. Hmm.
So
I think it's the balance.
yeah,
We want to teach the patients how to prepare a balanced plate. We do know that not everyone can be 100% plant-based. I am 100% plant-based for many years, many, many, many years. But I try to teach my patients that you look on your plate and you ensure that on your plate, 50% is plant food, green or raw veggies or fruits, and then steamed veggies, and then good complex carbohydrate, and a quarter protein, because people tend to overconsume protein, not knowing that protein can be toxic not only on the kidneys but also on the liver. So
right.
we had that is why when you try to tell them, okay, go plant, they believe, well, if I go plant, I'm going to be anemic. I won't have enough protein. I won't have enough iron, and so forth. But we have to teach them what is a balanced meal. And that is very, very crucial.
Yes.
All right. So we're getting close to the time. We're still 12 minutes early. So we still have some time to talk a little bit more. Now, have you ever had any patient on already stage 5 chronic kidney disease as a result of diabetes or hypertension who have reverted to a healthier stage?
That is the million-dollar question. Well, I have had a couple of patients who started dialysis, and um, well, they didn't need dialysis anymore.
Okay.
Um, but eventually they ended up back coming on dialysis. Um,
Ended up
and
back on dialysis?
right, yes, and that's actually been the trend.
Mm-hmm.
You know, more patient when they start that, you know, that's it. They usually stay on dialysis. Um,
Mm-hmm.
but but there are a couple of them, one or two that you know, start and then you know, they don't need dialysis anymore.
Mm-hmm. Mm-hmm. Mm-hmm.
So, but yeah, once you know, you progress down the stages, the chronic kidney disease stages, it is kind of difficult, you know, when you get to stage 5 to you know, to reverse it.
Yeah.
Well, from my experience, I mean, what have you seen?
Oh, it's the same. It is better to prevent than to treat. And
Yes,
that is what we're trying to get out to the patients, that you prevent diseases with a healthier lifestyle. What you consume, the amount you consume, your exercise, the way you live your life, prevent the disease rather than treating. When you get to treating, it's a little more difficult. So
right,
patients who have diabetes, we want them to be compliant with a healthier nutrition, and therefore protect the kidneys, protect the cardiovascular system, protect their circulation from peripheral vascular disease, and keep their legs rather than having amputation. So yes, I have seen the same. Now, what I've noticed though, I've had patients who I have given one diet and I put them on plant-based diet or mostly plants, and then when they go to the center, dialysis center, they're told to eat a lot of protein, eat a lot of meat, and then they'll come back to me and say, Dr. Cooper, My sugar is now uncontrolled. I said, listen, just follow what I give you, and then it'll come back, the sugar is controlled. So we do know that even though they might be in end-stage renal disease on dialysis, but if they follow a plant-based nutrition, they will stay healthier. The sugar will be better controlled. So that is what we need to do.
Absolutely.
And as educators, we have, patients want the information, and they're looking for people who can guide them. No one wants to be in 10 drugs or 5 or insulin for their diabetes. But where do they get the information? That is the hard part of it. And sometimes they try to go on a diet or change to a healthier nutrition, but they need guidance. How to balance that nutrition, what to consume, how much of it to consume. And I see that as a problem sometimes. So I believe that during the next 2 weeks or so, we'll spend some time on diabetes, how to use a healthier lifestyle to improve the sugar. A study was done with some pre-diabetic diabetes prevention program where 3,200 patients were placed on lifestyle versus metformin versus placebo.
Right.
And at the end of the study, it was shown that those that were on nutrition and exercise, a healthy lifestyle, intensive lifestyle therapeutics, prevented their disease, significantly lowered the risk of heart disease. They lost more weight, and they lowered the risk of developing diabetes than even those that were placed on metformin. So we know that nutrition and a healthier lifestyle is potent in regards to decreasing not only diabetes, but also other chronic diseases.
Yeah, absolutely. So, so that is the message to be brought to the mass.
Mm-hmm.
Prevention is better than cure, like you say.
That's right.
And it's a lifestyle change. It's not just a diet.
That's right.
The lifestyle change, and it's even more than just nutrition. It's exercise, and you have this. I'm sure that you know about this, the New Start philosophy, which you probably teach your patients.
Mm-hmm.
Nutrition, exercise, water, sunshine, temperance, air, rest, and trust in divine, in God.
Mm-hmm.
So it's a combination, and with that combination, you have a increased level of success.
That's right. A study was published in one of our medical journal in 2013 showing the most common risk factors for chronic diseases like diabetes, hypertension, and death. And the number one risk factor, do you know what that was?
No, tell us.
It was actually nutrition. It was diet.
Right.
So diet plays a very, very vital role in whether or not you become ill or whether or not you stay healthy. So I always say that what you consume could be killing you or curing you. And that is a known fact.
Right.
That's evidence-based. I like to use evidence-based new information for my patients. So while we're waiting, we're asking people to go ahead, and we have 5 minutes to go into the formal program. I'd like you to go ahead and share. Have your friends come on as we discuss diabetes and how we can use nutrition to blunt the effect of diabetes, to actually reverse or prevent diabetes. All right. Yeah. Oh, yes, we're live on YouTube as well. All right. So share. Guys, we have Mr. Crawford here, who has 14 years of experience in nutrition and diseases, right? He's a nutritionist or dietitian, was trained in Andrews University in Michigan.
Right.
has now been practicing for about 14 years. He practiced acute medicine, and now he is doing, for the last 8 years, he's working with patients with chronic kidney disease. My name is Dr. Cooper-Dockery. I'm board certified in internal medicine, and I have been practicing medicine for many years. I left medical school in 91, got my residency in 96, 93 to 96 in New York, Metropolitan Hospital Center, and I have been in the Rio Grande Valley since 96. I love to educate. I love to share my knowledge with others. And consequently, I started Cooper Wellness Center maybe about 8 to 10 years ago. And we run 8 weeks to wellness program or 12 weeks to wellness. And we have seen significant changes in our patients. Patients have come in, they have lost weight, they have improved their blood pressure, improved blood sugar. Patients have even gotten off medication entirely or decreased the number of medication. A lot of patients love this because they don't want to be on medication for the rest of their lives. So they just like this. As a matter of fact, we just started our 8 weeks to wellness program at the Wellness Center. Given the COVID-19 pandemic, we were not seeing face-to-face patients in the center, but we have been getting calls. Patient wanted to come back in, and now we're trying to restructure the program so we have smaller classes so we can maintain the social distancing and keeping all the precaution so we don't we can eliminate COVID-19. So we're just happy to be on all of these platforms tonight as we discuss diabetes and how we can actually prevent, reverse, or improve type 2 diabetes especially. But if you have type 1 diabetes, this information is for you as well. Because if you follow a healthy lifestyle, emphasizing healthy nutrition, you will decrease your sugar, you will improve your sugar, and therefore decrease your insulin need. So if you have type 1 diabetes, it's for you. If you don't have diabetes, but you don't want to get diabetes, the information is for you too. So the information is for everybody. All right. So we are in 1 minute, we will be going straight into the formal presentation with Mr. Crawford. From, where are you from again? Is it Georgia, you said?
Yes. I'm currently living in Columbus, Georgia. Columbus, Georgia, via Jamaica.
That's right. I think everybody who listens to us will know that we are from Jamaica. I have been here for many years, but of course I'm from Westmoreland, the western side of the island of Jamaica.
Yes, awesome.
All right. So, Mr. Crawford, I want to welcome you again to the platform. And given the fact that it is Diabetes Awareness Month, and because diabetes is such a disease that is just causing so many complications, I wanted to come on and to share some information. So welcome again as you present to us diabetes and nutrition.
All right, well, thank you again, Dr. Cooper. I appreciate this opportunity to present and appreciate your Tamika, which also extended to me the invitation via yourself. So like I said earlier, I've worked with diabetic patients in my 14 years of practicing nutrition. And I in terms of the patient population, I see a lot of people, a lot of patients, struggle to control their diabetes and to get things right, but they don't necessarily have to be in that predicament. And so this afternoon or this evening, just wanted to go over some things that we can do to either reverse it to or prevent it. And Dr. Cooper has said that she has worked with a lot of patients, and she has seen a lot of individuals, get off their medicine and pretty much reversing the disease process. And so, when it comes to diabetes, right, and preventing diabetes, it's a lifestyle change, or it's the lifestyle that matters the most. And so I just wanted, before I even go into, what is diabetes and going into the pathophysiology, just wanted to take some time to talk about, why do you care? Why do you care to prevent diabetes? Why do you care to reverse diabetes? Why? And I think, that has to be the question that must be answered. And when that question is really answered, we get the motivation, we get the drive to really, make these lifestyle changes that will ultimately result in better health. And so, looking at lifestyle, you know, um, if you were to, or if an individual were to get diabetes, what would their lifestyle look like? What would be some of the things that they it would be hindered, or they would be they couldn't do as well, or as much. How would that affect their family? If they get diabetes, what would be some of the end results or the consequences? Getting on eventually getting on dialysis, loss of limb, potential blindness, stomach problems as it relates to gastroparesis. There's just so many complications that results when a person gets diabetes. And so, if we were to look at these, all these factors, could that provide a motivation, a drive to, to be on the right path, to get on the right path, and to prevent this disease or to reverse this disease? What about finances? Or what are the impact and the implication on the finance? What toll would that take? And so, as we evaluate all these different factors, we'll see that, these really do provide a big driving force um, to not get diabetes or to reverse diabetes. Um, you know, so when it comes to lifestyle change, you have to have these whys. You have to have the desire to stick to the lifestyle change and to go forward with the lifestyle change. You have to, have some solid reasons, right? Do you see a need for the change? And so all of these things have to be addressed really before the lifestyle change can happen, and 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 even sticking to the lifestyle change. So, if there's anyone in the chat, or on the line, um, do you care to share any whys with us as to why it's important? If I don't know if anyone has diabetes, what are your whys to preventing diabetes or reversing diabetes? Um, or what do you hope to gain from from this discussion?
All right, so we're gonna wait.
Anyone?
Let's wait for some people to answer why. You can put your comment there. Why would you like to prevent diabetes? Many people. I had a gentleman who walked into my office, and he said that, Dr. Cooper, everyone in my family has diabetes, so I'm going to get diabetes. But then when you discuss some of these complications like blindness, then that is the reason what that will motivate them to take care of himself and to prevent diabetes. The other one is dialysis. Most patients do not want to get in dialysis. So these are some of the whys, or the reason why they might want to reverse or prevent or change their lifestyle so they don't get the disease.
Yes, absolutely. And having worked in dialysis for 8 years, I can really tell you that while the procedure is definitely a life saving procedure, but the process, the things that they go through on a daily basis, it's just really difficult, and it really pains my heart to see them go through it. Having to come to dialysis some 3 times a week or more, and then having to just to endure the different just financial issues. A lot of patients end up not being able to work. There are some patients who can work, but then there are some that most of them, uh, you know, they're not working, so their finance is affected. Their lifestyle is definitely affected. They have to be at treatment for 3 days a week, anywhere from you know 2, 3, 4, 5 hours on the machine, to clean their blood to reduce the toxin. And then some patients, not only are they on dialysis, but they develop further complications, like calciphylaxis or calcification of soft tissue from phosphorus. And, and that phosphorus just destroys the blood vessels.
Mm-hmm.
And that destruction of the blood vessels results in, amputation, heart disease, and so much other things, and blindness.
Some patients on dialysis, they develop blood clot in the graft. So they have recurrent clot. Not only that, they have infection. So patients who are in dialysis essentially, or even diabetics in general, they
Right.
have decreased immune system. So they're at high risk for just about all infection. So that's one of the reasons why you want to learn about diabetes. You want to prevent it. And if you have it, you want to try to change your lifestyle so you can reverse it. A lot of people want to know about diet. What should I eat? They'll come into my office and they'll be asking question, doctor, I'm here for a diet. I have diabetes and I don't like the insulin. So give me something so I can get off the insulin or get off all these pills. It's a process. Now, you're a dietitian, so talk to us about diet, because I think most of our listeners want to know what to eat. So what should I do then to prevent or improve my diabetes?
Right. Good question, and that will be addressed in the presentation. You're speeding me forward.
Okay,
Look,
okay, okay.
which
Take
time
your
do you
time.
think?
Okay.
So with diabetes, just wanted to go talk a little about what's going on, when it comes to diabetes. So typically when we eat food, um, you know, the food is broken down, especially, well, carbohydrates especially is broken down to glucose, and glucose gets into our blood circulation, right? So you see this diagram here. This is a blood vessel here. Okay, you can see the pointer.
Mm-hmm. Yes, yeah, you're
Okay, all
good.
right, good.
Mm-hmm.
Okay, so this is the blood vessel here. The glucose from the meal. Of course, the glucose, the carb, the complex carb is through different enzymes in the stomach is broken down to glucose. Enters the blood circulation here. And so as glucose enters the circulation, right, insulin enters from the pancreas. So that comes into the circulation. And pretty much the role of insulin is to help the glucose to get into the cells here. All right. So you can see here the insulin going into or attaching to the receptor site of a cell, usually muscle cells. And as the insulin attaches to the cell, it opens up, glucose gates here, and the glucose is able to get into the cell. So, so in a nutshell, this is where most of diabetes, well, this is where the problems necessarily goes wrong, because many things can happen to prevent this process from occurring. So either one, the cell membrane could be lined with a lot of fat, so the glucose or the insulin cannot get into the receptor site here. Um, and so therefore the glucose wouldn't be able to get in, because the insulin is like a key that unlocks the gate for glucose to enter in. So if this is laden with fat, or these cells, they become insulin resistant, and we have a problem there. That type of diabetes is usually called type 2 diabetes, right? And then type 1 diabetes is when if the insulin, if there's not a lot of supply of insulin, meaning the pancreas or the beta cells in the pancreas, they're not producing insulin at a sufficient level, and so there's no insulin to open the cell gate to let the glucose go in, and that's typically referred to as type 1 diabetes. So there we have two types of diabetes, type 1 and type 2. Now, from nutrition standpoint, what can we do to help to reverse this process or to improve this process? Okay, well, one, addressing the issue with the fat blocking these cell receptor site. What can we do? Well, we can reduce the body fat, and as we reduce body fat, then these cell receptors, they become cleared, and insulin can get in easier to open up these cell receptor site. And so that's why weight loss is important. And in order to get to weight loss, we have to exercise and watch our diet. Caloric reduction is important. All right. So exercise and caloric limitation is important, and specifically, using plant-based nutrition is going to be important to help to reduce your weight. Because if we focus more on a plant-based diet, guess what? We're getting a lot of fiber, and when we get a lot of fiber, naturally this fiber doesn't get digested. So you get the bulk, right? But you don't get a lot of calories. So you're less likely to put on weight when you're increasing your fiber intake via plant-based diet. Okay, so you think about vegetables. Vegetables are very low in calories, um, right? And then whole grains. Whole grains, it's going to have a lot of fiber, and that fiber is going to, bulk up, pretty much bulk you up, so that you feel full, and so you're reducing your overall caloric intake. All right, so so that's important there. Another important aspect of sorry here. All right, so another important aspect of this mechanism here is to be careful with the sugar intake. All right, because let's say you have type 2 type 2 diabetes right here, um, and you have reduced sensitivity to you know, reduce sensitivity or you know, insulin resistance here at this point. Well, if you have a flood of sugar molecule coming in, um, you know, it's not going to get into the cells. So it's going to stay in the bloodstream. And that's when we get a lot of problems, when the sugar remains in the bloodstream. And as the sugar remains in the bloodstream, right, we get a lot of the tissue, the blood vessels get damaged. Um, important concept when it comes to nutrition here is to reduce your total carb intake. And carbohydrates, as I mentioned before, gets broken down to glucose. So we want to focus on limiting our glucose intake. Concentrated sweets. So what are some concent- concentrated sweets that a lot of patients love and don't want to give up, right? They like their sodas, they like their cookies, they like their pies, you know, their chips, and you know, so those those concentrated sweets are loaded with sugar, and you know, we're just flooding these blood vessels with sugar, and you know, it's going to cause a lot of damage because you know, they can't go anywhere um, because you know, the membrane is blocked up there. Um, all right, so those are some principles there. Other things that we want to focus on that we talked about here is we choosing high fiber food to reduce spike in blood sugar. All right, so not only will high fiber food help to prevent to prevent weight gain, right? It also will help to reduce the spike in blood sugar. Now, why would it be important for us not to have that spike in blood sugar? Well, the it's important because you know the body is able to you know, to work a lot better if you don't have these spikes in blood sugar. You know, you want that nice even you know, consistent, smooth um, you know, blood sugar level, and so the fiber helps to prevent those spike. Do you have anything to say about the spike in blood sugar and how it affects diabetics adversely, doctor?
Yes, yes. So we do know that high blood sugar has negative effect on our health. Let's just look at the immunity. Now we are in a COVID-19 pandemic, and we want to ensure that we have strong immune system so we can actually fight the disease. What happened to your white blood cells when the sugar is high? There are various things that happen to the white blood cells. The white blood cells, these white blood cells are the cells that defend your body against infection. But when the sugar is high, the white blood cells cannot move as they should. So the high sugar inhibits the ability for these white fighter cells to work and to trap bacteria or trap viruses so that we can be kept healthy. So that's one problem. The other problem is that the high sugar, the blood is more viscous. The patients that risk for other complications, blood clots, and so forth. But so we want to maintain, and of course, the high sugar will lead to more inflammation, damage to the endothelial lining, the blood vessels, and that is why patients who have diabetes have higher risk for cardiovascular disease, heart attacks, and stroke. All right. Patients with diabetics also have a higher risk for cancer. So we want to ensure that the blood sugar stays normal. That is why we give the insulin. Insulin to take the blood sugar from the blood vessel into the cells. We give the pills so we can use up, the blood sugar. We ask you to exercise. Exercise, when one exercises, what happens is that there is an increased demand for energy from the sugar. So the large muscles use the sugar and therefore lower the blood sugar. So we want to keep the sugar low. We don't want any spikes. That is why we ask you to consume complex carbohydrate or a high fiber diet. And you might ask, what is a high fiber diet? How much fiber should be in my diet daily? And for women, about at least 25, 28 grams. For a man, about 35 grams of fiber. So we want you to consume a diet high in fiber. Now, where do you get the diet high in fiber? Plant-based. I'm going to let the dietitian continue. I'll just add in as we go along.
Thank you, Doc.
Mhm.
So definitely, another point here is to enjoy whole plant diet with emphasis on limiting carbs. You know, if you're diabetic, to prevent and improve diabetes mellitus. All right. So just also wanted to mention some things here on infection and diabetes. And you know, Doc actually went through those things. The high level of sugar in the blood, right? It ends up damaging blood vessels and nerves. And when these blood vessels and nerves are damaged, then we can't really have the components of the blood, right? The white blood cells available, circulating effectively because the blood vessels are damaged. They're gone. And I've seen a lot of patients where you look at their feet and it's just kind of like it's black. It's like gangrene, and that's because of the high level of sugar in the blood. It just eats away at those blood vessels, and so when those blood vessels are gone, then infection comes, and infection just pretty much cause a lot of damage. And another thing with increase increased blood sugar, uh, that relates to infection is reduction in phagocytosis. Sorry,
No,
phagocytosis.
phagocytosis is correct. Phagocytosis, that's when the white blood cells engulf
Right,
the microbes, whether they're viruses or bacteria, they're engulfed and destroyed. In doing so, then the risk of infection is lessened. Now, when the sugar is high, if you have persistent high blood sugar, now these white blood cells cannot move as they should. They cannot engulf the bacteria and the viruses, so patients are at higher risk for infection.
right. So we have reduced overall immunity, and usually like I said, diabetes, and we have the the peripheral areas usually are affected a lot. I see a lot of amputation, missing fingers, and so forth, because those blood vessels, especially on the peripheral areas, they are destroyed because of infection and high blood sugar. So those those are some things. All right. So what are we going to do in order to reduce these infection? All right. Obviously, we have to reduce the sugar intake. And how do you reduce sugar intake? Like we said, high fiber diet, focus more on vegetables, um, and leave the concentrated sweets alone, the cookies, the pies, the syrup, and all that stuff. It's not good for the blood vessels. And also, a high sugar intake is going to pretty much make your white blood cell lazy, right? They just don't want to work as much. And so what are some things that optimize the white blood cells? Well, here's some foods. So the um, mushrooms, ginger, garlic, onion, green onion, they're going to kill microorganism, right? Um, and reduce infection. Things like elderberry, golden seal, echinacea, we can use these to build your immune system. And also, you know, another thing is we have to our optimize plant protein intake, because this plant protein is going to be helpful to make antibodies and hormones, right? And you get the protein from your beans, your lentils, your nuts. As we can see here, beans and lentils, they have zinc and fiber, nuts, selenium, and vitamin E to improve, you know, immune function. So these are some key ideas here that we can key takeaway to, you know, as it relates to nutrition and infection, and as it relates to diabetes. All right. So to any any questions?
All right. All right. So I'm sure people usually want to know, what can I consume? We can probably go off your, go back to the regular screen. Okay.
Okay.
So that's a question I get a lot. They come in and patients want to know what to consume. And all right, so how do we go back here? So most importantly, let's just think about things that you should not consume or you should reduce.
Okay, as it relates.
Mm-hmm. Go ahead.
How do we maximize the screen?
Let's get the screen back. So I'm sure there are people thinking, all right, so if you stop sharing your screen, maybe we'll get off. You want to do stop sharing your screen?
Right, okay.
Okay, good. So we'll be back on here. So how do you advise someone? They're diabetic and they come into you and they say, you know, my blood sugar fasting before I consume my breakfast, it's usually 150. We know that we want the fasting blood sugar to be at least in the normal range, between 80 and 100. And if they're waking up with a blood sugar of 150, then after breakfast it's going to be 350. And they might ask you, so what should I consume? Okay, can you list some foods that you want diabetics to have on their plates every day that will actually reduce their blood sugar?
Okay, good question. Um, as it relates to that, we want to focus on foods that are not going to increase the blood sugar, right? And what are some foods that will not? Let's go over foods that will not increase the blood sugar. Um, your vegetables, right? Because most vegetables are not going to be high in sugar. Okay, so as it relates to what protein, different protein items are not going to be high in sugar, so you're not going to have increased blood sugar with protein items. So let's go to let's say a typical lunch, right? So what would that look like? All right, so you have your vegetables, right? You have your protein. What type of protein? Well, you can add you know, there's so many protein foods made from nuts and different types of beans. Okay, so that would be your vegetables, your protein. Now your carbohydrates. Now we do need some amount of carbohydrates. Um, and as I said before, the carbohydrate will break down to sugar. And so that will increase your blood sugar. However, there are some things that we can do to reduce the load or the carbohydrate load, right? So one is to make sure that the food is a whole grain, right, item, right? So instead of eating white bread, instead of eating white pasta, instead of eating you know,
White rice, you do
white
whole
rice,
grain,
right?
brown rice or black rice or wild rice. You do quinoa for grains. I also want to mention the glycemic index. I know I want to list that. And if you get my book, 14 Days to Amazing Health,
Okay.
on page 44, I have a column that says glycemic index. What is that? This are foods that will not spike the blood sugar rapidly. They have low speed to get to the increased blood sugar. Now I'm going to read some foods here and their glycemic index. If the index is 60 and below, that's great for diabetics. So I'm going to start with wild rice. So wild rice, the glycemic index is 51. That's great for you. Kiwi, mango, banana, brown rice. Brown rice, the glycemic index is 50. Whole wheat bread, glycemic index of 49. Grapes, peaches, 40s. Let's do some vegetables. Soybeans, 18. Um, Broccoli, mushroom, 10. Cabbage, 10. Kale, 2. Cauliflower, 15. I always call this the free foods because the glycemic index is so low. Spaghetti. Spaghetti, the glycemic index is not high. All right. Now, if we go up to glucose, the glycemic index is 100. You want to stay away from sugars. White potato, the glycemic index is 85. So you should do the sweet potato over the white potato. You can do things like squash, zucchini, pumpkin. All those have low glycemic index, but are high in fiber, high in water content, will keep you feeling fuller longer, and therefore decrease the need for you to be eating all the time and increasing your calories. And calories will then transfer into the fats, obesity, and then high insulin, high sugar, and the cycle continues. So if you want information, find my book, 14 Days to Amazing Health, or go to my website, cooperwellnesscenter.com, and find resources there. So vegetables are great. Fruits are good. If you're going to have a banana, you should have half a banana. So that's a serving. If you're going to have mango, don't have a whole big mango. I know people from the West Indies like myself. We like to eat mangoes, and we eat multiple mangoes.
Right.
But if you're diabetic, you want to reduce the intake. Pineapple, something you have to reduce that to. Grapes, you should have about 8 or so grapes. That's a serving, or else you will have too much, your sugar will be too high. All right, so stay away from fats. You know, as Mr. Crawford mentioned, that a high fat diet or obesity will lead to fat sitting on the insulin receptor site on the cells. If the fat is sitting on this cell, it means therefore that the insulin will not be able to take the sugar from the blood into the cell.
Right.
Because the receptor will not open the channel. And if we cannot get the sugar into the cell, the glucose into the cell, where will the glucose be? In the blood, circulating in the blood. That will cause diabetes and all the complication of diabetes. All right?
Right.
And of course, go ahead, Mr. Crawford.
Yeah, so definitely just to just to reiterate your point there about the glycemic index and limiting foods that are high in carbohydrates. That's important to to overall lower your blood sugar. And the fruits is actually high in fiber, but you do have to limit. We encourage patients to just limit their total carbohydrate intake in general. Emphasize high fibers, and about 4. We usually like to do about like 4 servings of carb each each meal, and 1 serving of carb would be like 15 grams of carbohydrates. So like half a cup of rice, half a cup of rice, half a cup of brown pasta, half a cup of fruit, and so forth. So the key is to limit the carbohydrate intake, to prevent that excessive amount of sugar in the bloodstream.
I think Tamika has some questions. Tamika, can you unmute yourself and let us know what questions you have? If you're there. Okay.
Yes, we're here.
Welcome, Tamika.
Oh, that's Tamika. Okay.
I'm here. Hi.
Oh, hey, Tamika, how are you?
I'm good. How are you?
Oh, I'm doing fine, thanks.
So my question is, for those who are listening. Is it because for a person who's diabetic, is it because I ate too much sugar or sweets or candy while I was growing up? Why I have diabetes?
That's
Okay,
a
well,
fantastic question for the dietitian. Go
no,
ahead.
I was gonna let you answer that. But actually, with type one, well, yeah, like we mentioned earlier, there's type one diabetes and type two diabetes. Um, Type one diabetes is more, autoimmune, genetics related. So it's less likely, you know, when it comes to type one, it's less likely the diet. But with type two, it's more likely the diet and the lifestyle. Um,
Okay, I'm going to chime in there, Mr.
yeah.
Crawford, and your
Okay.
voice
Go
is
ahead.
very low. You need to speak up a little louder. So as you mentioned, type 1 diabetes, autoimmune, the pancreas, the beta cells in the pancreas are destroyed. The patient is not producing insulin, and that is why there is no insulin to take up the sugar and put it in the cell. I'm going to give you a segue. When I was in a medical school, I was in Jamaica working at Bustamante Children's Hospital. And there was a 6 months old baby there. 6 months? Yeah. Baby was very ill. We didn't know what was wrong with the child. And then after we did blood work, do you know what? The child was diabetic. That's my youngest diabetic patient. That was
Wow.
type 1. At that age, patient was severely ill because the sugar was about 600 when the baby was diagnosed. So type 1 diabetes, there is no insulin. Now type 2, as we say, it's usually 80 to 90% of patients with type 2 diabetes, we could say it's a lifestyle disease. It's either that they're overweight and therefore they have what we call insulin resistance, or they just eat the wrong food, no exercise. Okay. So yes, we can reverse or help about 80 to 90% of patients with type 2 diabetes to decrease medication or get off medication entirely because it's a lifestyle disease. So it's not necessarily because you eat too much sugar, unless someone eats too much sugar and become obese, okay,
Okay.
become overweight, and now develop metabolic syndrome and type 2 diabetes because now there is insulin resistance because of extra fat. Okay.
Oh.
Next question, Tamika. Do you have another question?
Yes, I have another question. So I have like friends who are diabetic and they eat often. So I'm asking, how often should he eat? Like every 3 hours?
Okay. No, some patients believe that to prevent low blood sugar, they need to be eating a main meal, a snack, another meal, and they eat every 3 hours. No, no. 2 main meals a day is good enough, but they can eat a third small meal. Okay? If one consumes every 3 hours, there's several things that will happen with the body. It takes about 5 hours for the stomach to go through digestion and to empty out. And if you continue to add food every 3 hours, one, the gastric system does not get enough rest. Two, the person's at risk to overconsume calories and therefore is at risk for weight gain. Okay, so I recommend 2 main meals or 3 meals. And even if the patient is diabetic and they're eating a high fiber diet and a balanced meal, they're not going to become hypoglycemic. When they start to become hypoglycemic, that's the time we start weaning off the insulin, weaning off the pills, and going more for nutrition, exercise, and stress management. Okay, Mr. Crawford, do you have anything else to say there?
Yeah, pretty much. You summed it up. You summed it up pretty good.
Okay.
Okay, my next question is it okay to eat fruits if you're diabetic? I know I'm concerned about like mangoes and bananas and grapes. So because they're so sweet, so I'm wondering if it's okay to eat fruits.
Fruits are good. We need to eat a variety of plant food. So not only vegetables and nuts and seeds and grain, but we need fruits because Different fruits have different vital phytonutrients that the body needs. We need to experience balance. We need to ensure that we're not overeating. For diabetics, fruits like pineapple, mango, grapes, oranges, we have to ensure that they're just eating a portion, and what is a portion is important. So if they overconsume these fruits, then the sugar will go up because the fruits contain glucose, will break down into glucose. Okay, so balance, portion size is important. That is why at the Wellness Center we have portion size module for patients to understand what is the portion. You know, when I tell patients that they need to consume 4 to 5 servings of fruits and 4 to 5 servings of veggies a day, they get alarmed. What? How can I consume that? But when you tell them that one medium-sized apple, that's 2 servings, and one banana, that's 2 servings, then they understand that they can do it. So understanding what's a serving is important.
Okay, okay. With fruits and vegetables, I know that you tend to lose a lot of weight once you're consuming a lot of it. So is a high protein diet best for a diabetic?
No.
And what diet do you recommend and why?
A balance. Okay. High protein can be toxic to the liver and to the kidneys. A balanced diet should consist of about 55% of carbohydrate, okay? About 25% of protein, okay? And about 15 to 20% of fat.
Right.
So a lot of people believe that 50% should be protein, but it's the other way around. All right. And if you consume good carbs, you're not going to gain weight because we need enough macronutrients, and macronutrients are protein, carbs, fat. These are macro, and we need macronutrient in various portion to produce energy for the body. So we don't need a high protein content diet at all. What do you say, Mr. Crawford?
Yeah, typically, in terms of the proportion that you gave, and it varies, but in general, you're definitely right. 55% carbohydrates, 15 to 20% protein, and then the rest in fats.
Right.
So you definitely need balance there, and carbohydrates is important also, for a diabetic, because that's how the body breaks down carbohydrate to glucose, and then glucose gets into the cell, and that's how the cell gets energy. So carbohydrates, glucose is important. You just need a balance, and increase fiber. Okay, and yeah.
All right, guys. Right. And when we say carbs, remember that you also get carbs from your veggies. You get carbs from your legumes. So that is why it's so important to do these lectures, to educate patients so they can actually understand why they're told to do certain things, and they can understand that their health is in actually their hands. All right, anything else as we close off?
Mm-hmm. No, I'm good. You answered everything.
And thank clearly. You, Tamika, for connecting me with Oren Crawford, our dietitian.
No problem.
So a question for you, Doc. Ketoacidosis. Can you address that issue, and what does that do to patients? Ketoacidosis.
Diabetic ketoacidosis?
Yes.
Yeah, that's a state, a complication in diabetes that you don't want to have. That's when the patient has limited amount of insulin. The patient is just consuming, the blood sugar is very high, insulin level to work is not sufficient. The body now start using fat to produce energy. This produces ketosis, acidosis. This is a very dangerous state. Patient needs to be in the hospital receiving IV fluid, IV insulin, and monitoring the blood sugar carefully. Sometimes infection can push the patient in this state, but that's a severe complication of usually seen in type 1 diabetic. There's a similar state where we call this diabetic hyperosmolar state. So it's not ketoacidosis, it's a different state that is seen in type 2 diabetes. That's a whole nother lecture. We want to focus tonight on using nutrition to combat and prevent diabetes. And I think we have discussed the foods. We talk about high fiber diet. We talk about staying away from liquid sugar, the juices and the syrups and all of that. Simple sugars in cakes and dessert foods, all that will increase the blood sugar. And then we emphasize using plant-based whole food nutrition to help to decrease blood sugar. All right, I'm going to give you a story.
Another thing, fluids, the importance of fluids you know, you want to talk about the role of fluids, you know, that's a part of nutrition.
Oh, absolutely.
and how that helps reduce blood sugar.
For anyone, now our bodies, we're made up of about 65 to 75% of water. When our cells are dehydrated, there are just so many things that can happen. Patient might present with fatigue, confusion, even state of coma. Patient can develop venous blood clot if they're not consuming enough water, right? We usually suggest use a simple the rule of 8 glasses of 8-ounce glasses of water per day if you have healthy kidney or healthy heart. You can also do your weight and divide the weight by 2, and that's the amount of fluid in ounces that you need. Water can cure many diseases: headache, gallstones, kidney stones, bladder infection. Water can help you prevent clots. There was a study done in Loma Linda looking at those patients that consume at least 5 glasses or more of water per day and those that consume less. The study revealed that those that consume above 5 glasses of water, and when I say water, just water, not tea or not juices, decrease the risk for venous blood clot by 50%. So water is medicine. No, that's a different topic because we can use water internally and water externally. Okay, so that's a different topic. But water, if you're diabetic, you should stay away from sodas. Why? Because sodas have a high concentration of glucose, which you don't want. And water is calorie-free, fat-free, and good for your health. But water is a separate topic. All right, so Mr. Crawford and Ms. Tamika, I want to thank you for sharing. And Miss Jonette, hi, she came from Scotland to be with us at the Cooper Wellness Center. So at Cooper Wellness Center, we have some new employees. We have Miss Tamika, who came from Alabama. She's from Jamaica as well. She's one of our health coaches there. And then Miss Jonette, she's initially from Bermuda, originally from Bermuda, came from Scotland to assist us. They're doing a fantastic job. So if you live in the Rio Grande Valley and you want to learn how to improve your health with healthy lifestyle, then call Cooper Wellness Center, 956-627. Hold on, let me get my numbers right. I have so many numbers in my head. Okay, so go to cooperwellnesscenter.com, get the information, and sign up with us. And you have 2 lovely ladies there to assist you. And where are you guys right now?
We are actually at Food and Med.
They are at Food and Med Vegan Restaurant. And yes, because we're discussing nutrition as a means of preventing and reversing disease, they are right there at Food and Med. Food and Med will give you the best nutrition you need to help to reverse your diseases. As a matter of fact, can you give us the story of the gentleman who came from San Antonio? He came to a wellness program from San Antonio, And he told us that, of course, he's diabetic, heart disease, obese, and all of that. For the 2 days while he was with us here in the Rio Grande Valley, he consumed all his meals at Food Vegan Restaurant, and his blood sugar moved from being high in the morning to normal. He actually had to decrease his insulin by 10 units because the food that he consumed at Food Vegan Restaurant was just powerful medicine that helped to decrease his blood sugar. So guys, if you're around here in the Rio Grande Valley, then go ahead and go to Food and learn what they have there. All right, I see somebody else joining us. I don't know who this is. But do you want to wrap up a little bit, Mr. Crawford, as we say goodbye and ask our guest to join us another time?
Oh, Sister Hilton. It's a Sister Muriel Hilton is joining us from Florida.
Oh, she's from Florida.
Yes. I'm sorry, I was on another meeting. I just saw their text. I will put up next week, Thursday.
Next week, Thursday, you can join us as we continue with diabetes, because this is Diabetes Awareness Month. We want to thank Tamika for organizing this with Miss Jonette. And we want to thank Mr. Oren Crawford for giving us fantastic information on diabetes in general. He did emphasize chronic kidney disease because he's a specialist working with patients on dialysis. And if you do not want to be on dialysis, just listen to everything he said tonight.
Yes. So, all right. Well, thank you again, Dr. Cooper, for having me on, and Tamika. May God bless.
No problem.
And if you're just joining, go back and watch a replay. You'll find valuable information that you can use to keep your blood sugar low or to share with somebody else. So I want to thank you all for coming on. Miss Muriel Hilton, we will see you next week when we talk again about diabetes. And we probably, if Mr. Crawford has time, he can come and listen and supplement the information that will be provided then. So thank you all. Have a wonderful night, and like and share and subscribe on whatever platform you're watching. Thank you so much. Bye-bye.
All right. Bye.
Thank you.
Oh, this is